Hi everyone. My name is Leslie, and I decided to make this video because when I decided to become a kidney donor, I started looking for videos or information online um, from other people that have donated and see like what's the process like and what everything is like, and I couldn't find very much. I could find more of like the recipient side, but not from the donor side. So that's why I wanted to make this. So a little about me: I'm 38 years old, and I am originally from Lima, Peru. uh, the girl that is receiving my kidney is um, a little younger than me, and she is from here from the U.S. We met in college. Basically, if you want to know more about the story of the donation and the surgery and how like everything like came together, I will post my blog down there on the description, so you can read more about that if you're interested. But I wanted to make this more about like the whole surgery and the donation and stuff like that. So first of all, like I told her I wanted to donate my kidney to her, and we started the testing process. That was back in January of this year, 2016, and um, the first testings were done at my local clinic here in town, and Um, basically, I just did them on the weekend because so what that entitled was to have a urine test that is a 24-hour urine test and blood test. For the urine test, you're required to collect your urine for 24 hours. So that's why I decided to do it on the weekend, because during the week I work, and you have to collect every single time you go. So yeah, so it's better if you don't have to like go places, or or be too much time outside, because every time you have to go you just have to collect. um and so that was that. They give you a container to collect your urine, and then when you go to take it back to the clinic, they do the blood test. They take a bunch of like tubes of your blood to test it, and that's it. Well, I thought that was it. uh, but then after that is tested, they make you do it all over again, just to uh, just I don't know, double check or something. I don't know. But they make you do it all over again. So then after all that is done, then you go to, well, I had to go to the clinic or the hospital where the procedure was gonna be done, and there that was for an all day testing. So basically you go like really early in the morning and stay until like 4:30, 4:30. What you do is like first they do x-rays, chest x-rays. They do an ekg. um, I can't remember if there was like a ct scan or something like that too, but they do like all those testings in the mornings, and then in the afternoon I met with the whole transplant team. So I met with the doctor that was going to be doing my surgery, with social workers, with therapist, like all these people that are basically trying to see if not only physically but also psychologically you're ready for it, because there's a lot of research that says that like you can like get like depression afterwards, or just they want to make sure that you're doing it for the right reasons, that you're not like being forced to do it too, and things like that. Um so that was my all day evaluation, and then after that, I think that was like, I want to say it was like mid June or July. probably mid-July. And then there was a then after that they told me, okay, now that we have all this, we're gonna present you to a board that is gonna approve you for donation. I didn't have to be present for that, but they just like told me over the phone, hey, like, you know, like it's gonna be this day, and then that day they called me and they said, okay, you were approved, and so I was super happy about that. um so then after that it's just picking the day. It's like not right away. So I was approved, I think, July 29th and of this year, so 2016. And then my surgery was last week on September 14th. So it takes a while because people already sign up for surgeries, and in the hospital where I did it, surgeries are only done on Wednesdays. So my surgery was, like I said, September 14th of this year, so a week ago. And yeah, so they tell you to be there at, well, they told me to be there at 5 in the morning. And so we got there, we registered, then we saw someone from registration, then we saw someone, we like they make you go in with the nurse and one other person to just start you with fluids and stuff like that. And then if you have more family members or something, they can come in. At that point you get to see, or I got to see, the girl I was donating to. So we saw each other pretty much until I went in, and that's your choice, of course, but I wanted to see her. So so yeah. And then so about almost 7 a.m. I went into the surgery room. All I remember is just like I was taken there. I saw all the nurses and all the people that were gonna be in the surgery. There was a girl that was just like pretty much watching, like it was like the, I don't know, I just call her like the kidney lookout. Like she was gonna be just like making sure my kidney was safe at all times. And she also like took pictures. I mean, the pictures are your option, but I thought it was cool, and so like I asked them to take pictures. So they so yeah, so she also took pictures. So I already remember it's just like talking to them for a little bit, and they put the oxygen mask on, and then I don't remember anything until I woke up. And so the surgery, it's supposed to started at 8 a.m. This is what they told me. Last 3 to 4 hours. And then they take you for like about an hour to recovery, and then they take you up to your room. My friend's surgery starts a little later because it starts when the kidney is coming out. And so, but by the time I woke up, I was already like getting to my room, if I remember right. And like pretty much right away they told me that my kidney the kidney that I gave my friend had started working. So that was like really encouraging and really cool. Sometimes I think I've heard it takes like a week or something. Yeah, so for her to start working right away, so that was nice. So when I came out, I had like 3 incisions. The doctor said I might have 2 on the side or 3, depending. They were gonna put cameras in through those incisions, I think, to see what they were doing inside. And then like just a big incision where they take the actual organ out. So the two on the side, right now I still don't know what they look like because they are covered with like band-aids, and they tell you just let them fall, like don't take them out or anything. When they fall is when they are like when they're ready to be exposed. So I don't know about those. I'm guessing they're really small because they're just covered with band-aids. And then the big one, in my case, I've seen a lot of other ones like on pictures and from other people and stuff like that. Mine goes straight up from my belly button, like it's a vertical line up, and about like 6.5 centimeters. I don't know, 3 some inches. Um, and they glued it, so it's just like it's just glue. I don't know if there's stitches too. I can't really tell. It's like kind of like purplish now. I mean, like I can show pictures if anyone is interested in pictures and seeing pictures of the incisions. I am willing to share, no problem. I'm not gonna share in this video because I think some people are grossed out by it. But anyway, so there's like those are the incisions. I was able to shower I think the next day. Yeah, and no problem with like the incisions being uncovered. I was in fluids. I was in pain medication. Now, to do the surgery, or in my case, it was a laparoscopic, obviously, because I have the cameras and stuff. So they put gas in your tummy, and so that gas to like pretty much so they blow you up like a balloon, and so they can move and look at stuff in there. So once they once they're done, the gas still remains in. So I think that's what hurts the most. When you get up, that gas kind of like goes up to your shoulders, and it really hurts. But they had me like getting up and walk that same night. Other thing is like before I went into the surgery, I went on the scale and I was and so they took my weight. I was like a little over my normal weight, but that's just because I think I was eating a lot before surgery. But anyway, but after surgery, I was like 10 pounds more than what I had been that morning. So that's a lot. I don't know if that's the gas and the mix of the gas and the fluids that they give you. They put through the IV. But yeah, I was like, and my belly kind of looked like I was like 4 months pregnant for like a week. Now it's looking more like probably 3 months pregnant. Anyway, and I think that's it. I mean, I went home. I could have gone home like really Friday. My surgery was on Wednesday. I could have gone that Friday, but I stayed until Saturday, and they sent me home with pretty much pain meds and a medicine for constipation because of the pain meds. And something, I mean, for me, I'm a big baby about pain, so just like staying on top of my meds was very important. I mean, it's pain from the gas, but it's like also a little bit of the discomfort. You don't really feel pain from the incisions, at least I didn't much from the incisions. It's more from like I think the gas, and you can feel like your whole tummy, it's like it gets like sometimes like hard, and it's like having like spasms, but like they don't go away kind of thing. I don't know. So it's been a week, and I am still, trying to like do my walks. They tell you to walk like 3 to 4 times a day. No, 4 times a day at least, 4 to 6 times a day. So I'm trying to walk, get up and walk. I'm trying to just do normal stuff. Eating has been really hard. It feels always like I am like full. So yeah, that's been really hard. And things that I like really like chocolate doesn't seem like so yummy right now. It's just like yeah, it's I'm eating very very little. um and they also tell you to like drink a lot of fluids, drink a lot of water. I'm trying, but it's being hard for sure. um well, if you have any questions, I'll probably make another video of how things go after. But if you have any questions, yeah, just ask me. I would be happy to share. I mean, anything about like the surgery, or how things are going for me. For my friend, things are going great. Yeah, she's eating a lot of things that she couldn't eat before. That was encouraging. She's yeah, she says she noticed like changes on her skin, on like everything. Like a lot of people were like really amazed by the fact that like we're like from different places, different races, and like still we can be a match. And I don't know, things like that. I don't know what the odds of that, but I think it's pretty cool that I was able to give her one of my kidneys, and now she's doing good. So we'll hope that things keep going good. And I guess if you have a question, just like leave me a comment, and I'll respond it as soon as I can. Okay, send you love. Bye.